Welcome to FIU Insights, this Facebook Live discussion. Today's topic is China's coronavirus outbreak. Experts at FIU discuss the global impact. I'm David Kramer, your moderator for today, and we are going to discuss the outbreak of the coronavirus in China as it continues to spread and the death toll mounts there, and looking at the U.S. efforts to screen travelers and also to look at what investors might be thinking about with the economic impact. What exactly is the coronavirus and how does it spread? How is China responding to this crisis? And how has the World Health Organization also responded? And what has been the global impact on markets, and how should investors expect to see the impact of this crisis as well? Joining us are four of FIU's leading experts, and to my immediate left is Dr. Eileen Marty, who's professor in the Herbert Wertheim College of Medicine and an expert in infectious diseases and travel medicine, who also works with the World Health Organization. Next to her is Professor Thomas Breslin in the Department of Politics and International Relations and an expert on U.S.-China relations. Next to him is Associate Professor Julie Zheng in the Department of Politics and International Relations and an expert on economic reform in China. And last but not least is Sheng Guo, who's an instructor in the Department of Economics and an expert in macroeconomics and labor. A welcome to all four of you. Thanks very much for being here. Dr. Marty, let me start with you, just so we can get an understanding of what it is this coronavirus is and how is it spread. What should people be focused on?
Okay, so this coronavirus fits in that category of coronavirus, the beta coronaviruses, that when they've infected humans have been far more serious, generally, than the alpha coronaviruses. There are other kinds as well, but for humans, those are the two we worry about. Alpha coronaviruses mostly cause common cold, not a big deal. Can sometimes cause croup in a little kid, can sometimes cause bronchitis or ear infections, but mostly they're just common colds. It's these beta coronaviruses like SARS and MERS and this new novel coronavirus, the 2019 nCoV, that tend to cause deep lesions in the lungs. So basically, it's causing a pneumonia, a viral pneumonia, with so many infiltrates in the lung that it makes it very hard to breathe. So that's part of the way in which patients manifest the disease. And also they're going to have a high fever, they tend to cough, and there are a series of other complications that if you want to, I can get into.
In looking for ways that it's spread, what should people be aware of?
Okay, so from my personal interest, how it spreads, we get down to the weeds of how the particular virus connects with its receptor on cells. But what you want to know isn't that. What you want to know is how are you going to get sick from it?
Exactly.
And
how not to get sick.
And how not to it, right, exactly. So really, these are, coronaviruses in general are spread through the respiratory route in humans. So so like most respiratory viruses, you're going to get it from droplets that are released from people who are already infected, or an animal that has a similar virus that can spill over into the human population. So that's the most likely route. But of course, if I have the coronavirus and I cough and I'm sloppy and I contaminate this table and you touch the table, then that's a fomite. That's a way in which your hands can transmit the virus by touching one of your mucous membranes and getting infected that way. So that's how it's transmitted as best as we can tell from all the data we have right now.
And a few days ago, you did a short video for FIU that's available on YouTube that I think does a great job of explaining all these issues. Just before we started today, one last question for you, and then I'll turn to the other panelists. We just got a headline saying that the World Health Organization has declared a public health emergency as a result of this. What does that mean exactly?
Well, it means that it's gone beyond a certain threshold of threat to the global community, right? And it's actually a legal term that's used, and it's based on the international health regulations, which the most recent version came out in 2005, that all member states of the United Nations are signatories to, which means they have to adhere to all the things that the international health regulation requires of them when an entity is declared a public health emergency of international concern. And there's a whole series of things that they have to do. That WHO did that, I think, was absolutely correct, very responsible, and very appropriate at this time. Would you like to know why?
Sure.
Okay. So this virus, as we're seeing now, is causing a mortality rate of about 2%, which is so 2 per 100, right? Compare that to your seasonal flu, which is 1 person to 1,000. So it's much more serious than a seasonal flu. It's less serious than SARS, which was less serious than MERS. And both of those were deadly viruses. This one, even though it's not as serious as MERS or SEERS per person, is far more contagious. And we're seeing it spread and the numbers growing at rates we've never encountered in these kinds of new emerging pathogens in recent years, despite our best efforts to contain it. So if 10,000 people are affected by a virus that kills 10% of the people, that's the percentage of people, right? But if you have 10 million people affected by something that affects 2% of the population, you actually end up with a larger number of dead. And so it's these kinds of figures. It's the fact that you have a growing and expanding portfolio of people who are getting infected that makes it something of international concern. We're having person-to-person transmission in multiple countries now, even here in the United States.
Great. All right, Shenghua, well, let me turn to you because in addition to being an expert on economics, you also have family in the region that is most directly affected. Maybe if you could just describe the situation that you're hearing from people in your family.
Yes, my hometown is a small city, 45 miles from Wuhan, the epicenter of the outbreak. So currently my parents, they are still living there. They hole up in their apartment and afraid of going out and trying to stay calm. They are connected with their relatives and friends through text message and chat groups. And so far, they still have food in the refrigerator, which is good because usually in Chinese tradition, we stockpile food and other supplies to celebrate to prepare for the Spring Festival. But right now, just today, I heard from them that there's a confirmed case in a neighboring community. So there's further restrictions of communication and travel, even between the communities.
And is it your impression that a lot of stores and other things are closing, so unless people did stock up on goods, they could be facing some serious shortages?
From what I heard both sides of the story. But most likely, the residents there still have food and basic supplies at home. And I heard that stores and supermarkets are still open. It is true that some goods and commodities on the shelves, they are gone. For example, the grains, green vegetables, these things went out first. But they still have like the sweet potatoes or carrots on the shelves. And the government is doing everything it could to make sure that the supply of food and the basic supplies are not interrupted.
Julie, if I could turn to you and ask you about the economic effects of all this, the potential impact if certain industries are closed down, say tourism is cut back significantly. Could you maybe talk about what economic impact this could have?
Sure. There's no doubt that this virus has dealt a major blow to the Chinese economy. This is also happened at a worse timing because now is Chinese New Year.
Yes.
And normally people would just travel to visit their families and friends, and it's a peak season of travel. Mm-hmm. And people would go to the store to buy things and to celebrate the New Year. But now if you go to China, you will see streets are empty and the stores are closed. Many of the stores are closed and people are staying at home. So China and the neighboring Asian economies face losses in aviation, transportation, entertainment, retail sectors. So in the short run, I think definitely China's economy would decline, would be negatively affected by this outbreak. But in the long run, I think if the Chinese government could contain this the spread of the virus, then the Chinese economy could recover and the economic activities would pick up the speed. So by the end of 2020, hopefully that the economy would not be so affected by this virus. But some economists predict that in 2020, the economic growth will reduce by 2%, will decline from 6% last year to 4% this year.
And do you sense that the government has any plans to deal with the economic impact of the virus, or is it too early for them to really have a clear sense?
Do you mean economic impact?
Yes, the economic impact, yes.
Yeah, the government now is extending loans to small and medium enterprises to help them to go through this difficult time because now the factories, the Chinese government is extending the Lunar New Year holiday. In the past, the Lunar New Year holiday is 1 week, but now it's extended for 3 more days, and the schools are closed until further notice to prevent the spread of the virus. So for small and medium businesses, it's a difficult time for them to get by because many of those businesses are expecting that this would be the prime time for them to sell things, sell stuff, and they can gain profit. So the Chinese government extending credits to those businesses for them to help them to get through. And as to some other measures, I think the government also is taking, I think most importantly, taking draconian measures to contain the virus. So that's more effective, I think, in the long run, that to help the business to recover.
And Xinguan, can I just come back to you for a second about the impact that people are feeling in the region? Do they feel that they are getting the necessary support from the government in this crisis?
Yes, I think most important thing is to make sure that food and supplies are still available. So according to what I have heard, they can even place online orders through their computer, so that companies can deliver fresh food and meals to their doorstep. I think that's a good strategy at this moment. And what the government should be doing, and I guess they are already doing, is to subsidize for the companies that are doing these deliveries.
Eileen, you wanted to jump in, then I'll come to Tom.
Actually, I have a question, because one of the things that from a medical perspective is supplies of personnel and medical equipment, oxygen, et cetera. And I am blown away by China's ability to stand up 2 hospitals in record time. Can you talk to me about the economics of that and how they're accomplishing this?
Yeah, if I may. So the Chinese government, actually, the National Health Commission that set aside $8 billion to the affected area, mainly in Hubei province, to help them to combat this crisis. And for the the 2 hospitals you mentioned, that the government is building these 2 hospitals with a combined total of 2,300 beds within 2 weeks. Yeah, it's just China's speed. And yeah, go ahead.
Yeah. I think China's speed in setting up hospital shells is pretty impressive. But there's been a national shortage of face masks, of face shields, and gowns for doctors and healthcare workers. So on the one hand, you have a very impressive infrastructure building project or 2. But on the other hand, the overworked medical corps and the health corps in general has been not adequately supplied. So that's one thing. As to getting food to people, the government's been now reported to be putting pressure on farmers to come to the cities to deliver the green vegetables that are a big part of the diet and so forth, because the farmers have been reluctant to come. China's successes in building its infrastructure since SARS, when they had a very weak infrastructure system, but now a huge network of high-speed transportation and, of course, airfields, has accelerated the possible spread of this disease and made it much more difficult to figure out who's brought what to where. One thing I think that will weigh on the economy and the country as a whole, China is vastly dependent on migrant labor. Tens of millions of migrant laborers typically go home for the Lunar New Year to central China and then come back to the coast, where they either work for the same company or find a higher paying job at another company. This year, the one looming question has to be, will they come back to the affected cities?
And can you also maybe talk about the impact this could have in other countries in the region? I read, for example, Thailand may be seriously affected by the lack of tourists that may be allowed to fly out of China. Just as an example, could you maybe just talk a little bit about that?
Well, I think there is a great deal of apprehension that's widespread in the region. And there's the matter of Taiwan, which is basically willing to cut itself off from the mainland. Hong Kong, which is part of China, of course, but it has stopped mass transportation between that region and the rest of China, and closed the schools as well beyond the holiday. So you had something, I mean.
Well, no, I appreciate what you're saying, and I think we need to get to a global level, because I'm seeing an impact not just on China's economy and not just on the regional economy, but say, for example, British Air has cut off all flights to China. United has slowed down its flights, et cetera. This has a spin-off effect on the entire global economy.
Right.
Yes.
And I think Miami Airport has indicated it is going to start testing people from the region, so that's likely to raise both the necessary precautions, but also some of the concern. Go ahead, Tom.
One of the things there's a spillover effect on the Chinese communities abroad. There's been some anti-Chinese feeling in Japan about this. Even in New York City, the large Chinese community there has been somewhat isolated by this. And there's a concern among overseas Chinese that there will be an upswelling of anti-Chinese feeling, or at least fear of the community, that will isolate them somewhat. So they, of course, worry about their relatives in China.
Sure.
And there are people who have come back from China, from Wuhan, in this recent period. So they'll need to be watched, and their contacts too, because we don't know that they can't be communicating or won't be communicating the disease if they brought it back.
Shen, go ahead. I'll come to you in a second.
If I can, may add something. So back in SARS, in the years of 2002, 2003, the Chinese output, the Chinese economy only accounts for 4% of the global output. But right now, the Chinese economy accounts for 15% or even more. So anything that that will be negatively affecting Chinese economy will have far more greater ripple effects across the global economy. So, so back to your mention of the local community and the discrimination against the community. As a member of the Chinese American community, I have seen the letter of the guidance calling for Chinese Americans who recently came back from China or had close contact with someone who did so to voluntarily self-quarantine for at least 14 days. And this is way before the quarantine has been taken by Chinese government. So I think that's the right thing to do. That's a good thing to do. That shows our responsibility for the safety of the community in FIU and in Miami metropolitan area.
And Eileen, I know you wanted to jump in, but let me also ask you there was, I think, a plane load of U.S. diplomats and families that was brought to Alaska. If you could maybe just describe also the steps that are taken to ensure that none of them is carrying the virus.
Actually, the Center for Disease Control has a very good handle on that situation. The passengers, and they included children, men and women of various ages, about 195 roughly, were all screened in China. They were screened again in Alaska, and now they're under a observation. And as they are released from observation, they still will be reporting back their temperatures twice a day and what's going on to a specifically designated epidemiologist who's going to be following them. So we're paying a lot of attention, and that is one of the reasons I wanted to jump in part because of that flight, and also because we're now more and more documentation of the fact that people are shedding virus before they manifest symptoms. And so that is one of the ways in which we have to worry about this virus because, for example, a perfect example is what happened in Germany. A woman from China came to visit a man in Bavaria. They had a lovely time. She was fine when she was there. She left, she was still fine. She gets to China, she's ill, and a couple of days after that, he comes down with symptomatic coronavirus infection. So clearly, she was not manifesting any symptoms when she was around him, but she was shedding virus.
Let me just ask one more question on the medical front. We are in flu season, is that right, here on our own without any import from other countries. So not everyone should assume if they're coming down with a cold or a flu that they're automatically coming down with coronavirus.
You're 100% right. Moreover, that's one of the messages I've been trying to send out is that one of the things that we should do is get the flu shot if you haven't gotten it already, because you don't want to be frightened by something that for which we don't have a treatment yet and we don't have a vaccine, when in fact you have something for which we do have several efficacious antivirals, and we do have a vaccine. And the other thing message that I've been trying to get across, and it goes to your green vegetables thing, and this is really important because that's why China needs to make sure that they're well supplied, because we need to have good, healthy nutrition and a balanced diet and exercise and good sleep to make our bodies ready to confront any kind of insult, such as this virus. So,
so those may be the two things they currently lack, and they stay at home most of the time, and they are not afraid, and they are afraid of going out, and even they take some walk, the walk is short, so not enough exercise may be one of the problems. As far as the green vegetables are concerned. From an economics point of view, I think the government shouldn't regulate the price to put on the price control, because by the fluctuation of the prices, the producers can see which commodities are in high supply, and they can take corresponding actions to make sure that the goods are produced and transported. If you impose the price control, then the signal of the prices will be muted. So there's no way of knowing which commodities are needed most and which are in short supply.
Tom, every crisis has a political component to it, and I wanted to ask you, what challenge does this pose to the Chinese leadership and how they're handling it? If I understand correctly, the Prime Minister has been designated as the point person for this. President Xi himself is not, at least officially in charge. If you could talk about that.
That's correct. Last October, at the full meeting of the Central Committee, the party basically said, look, China's entering into a new age. It's no longer a cooperative age on the global scene. It's a competitive age. And only the party can take the country through it. This leadership can take the country through it. So basically the leadership, the central leadership, put everything on its shoulders. And now, in this particular crisis, the governor of Hubei province is basically saying, look, we were slow to announce this publicly because we were waiting for confirmation and permission from the central government. So if this spreads, let's say, on a scale greater than the SARS epidemic, with mortality lower but more extensive, it could put a tremendous amount of strain on the central government. A lot of face is involved here, and a lot more than putting up 2 hospitals in one city, because basically a province is being, with tens of millions of people, not 11 million, but but tens of millions of people are involved. And this North China Plain area, just to the north and east of it, is intensely populated. So this has a possibility of spreading very quickly, very extensively, and totally overwhelming the sort of fragile public health infrastructure of the country.
And how might criticism, if it comes about, manifest itself? If people are afraid to all get together because of fear of the spread of the virus, how might they express any criticism of the handling of it?
The reporting out of China, the main channels in the U.S., indicates that the censorship level is high, but it's not as effective as it has been in other areas in previous months and weeks. So people are finding a way to communicate their concerns with one another and their fears as well.
And Julie, just recently, the United States and China signed what I guess the phase 1 of a trade agreement. Could this have a significant impact not only on that particular phase, but on negotiations between China and the United States on a trade agreement, do you think?
I certainly hope not. And yesterday I checked the number that for China, in the past, that China relies on 3 engines for its economic growth: the investment, export, and domestic consumptions. And in recent past decade, the Chinese government intentionally shifted the gear, that trying to make domestic consumption a major engine of economic growth. And actually, the number shows that the domestic consumption contributed to about 60 to 70% of GDP growth. So China, in a way, we can say that China's economy now rely more on domestic consumption. And of course, the phase 1 agreement between U.S. and China is a major success and can help people to allay the fear that the trade war could break out between China and the United States. But going forward, I think China and the United States maybe will resume the talks and after the containment of the virus.
Go ahead, Tom.
David, in the 2002-2003 SARS period, tourism, including domestic tourism, it was 2% of the Chinese budget. Now it's 5%. And so there's a greater vulnerability there. Cruise lines have been pulling back and readjusting their schedules not to go to China until things are more clear. So both domestic tourism, which has been growing at 15% a year up until now, and foreign tourism are both going to be affected. Chinese tourists are the most free-spending tourists in the world. They keep Paris afloat. And, true. And Louis Vuitton and all the sellers of vendors of luxury goods have to be very careful now because they're going to lose a fair amount of their market.
And I think I saw this morning there was a ship in the Mediterranean that has been quarantined with quite a few thousand passengers because there's fear one person may be infected. Sheng, if I can come to you in our closing minute or so, how concerned should business people and investors be about the impact of this crisis on the global economy?
So right now, there's so much unknown, so much that we need to learn about the virus itself, about how fast it is spread, how effective we can control the outbreak. So at this stage, this is what I call what we experience is what we in economics we call the temporary negative shock. So it's supposed to be short-lived. It's supposed to be temporary. The effect of this is that the freezing of spending on a consumer side, and also the freezing of the workers going back to work. So, but on the other hand, the consumers still have the money in their pocket, still have the savings in their banking accounts, and factories still have the machine in place, still have the parts, have the inventory. All that they need is just to wait for the workers to come back. So as long as this is can be resolved in a fairly short period of time, I would say investors shouldn't worry about that long time. However, if several months, like half a year passed, and we still see no resolution in sight, and we are still worried about the safety, then that would alter the business plans and business strategies that may change the considerations of the investors. And I would say at that time, it becomes a permanent, persistent shocks, and we don't want that to happen.
And unfortunately, we're going to have to leave it on that note. Let me thank Sheng Guo, Julie Zhang, Tom Breslin, Eileen Marty for joining us for FIU Insights. Grateful for your expertise and thoughts on this very important and timely subject. Something tells me we'll be coming back to this issue before too long. I'm David Kramer. Thank you very much for joining us for FIU Insights. We look forward to seeing you next time.